Hi everyone, my name is Grace. Today I'm going to be presenting a 2025 Journal of Cancer Survivorship paper. It's titled Psychosocial Correlates of Physical Activity in Cancer Survivors, a Systematic Review and Meta-Analysis. Um, the authors, I have some of their institutions listed below, and then I do have the impact factor of the journal, which was 4.5 to 5. Starting off with the introduction, physical activity is one of the most effective behaviors for improving cancer outcomes. It reduces fatigue, improves quality of life, and lowers recurrence and mortality risks. Yet, as a whole, and after reviewing a lot of research, most cancer survivors don't actually meet physical activity guidelines. So, only about one third of cancer survivors reach the recommended 150 minutes a week. So, this article is going to help us understand what drives or what hinders activity. And I think that that's pretty essential for closing this gap of why do we have cancer survivors who aren't meeting the guidelines for physical activity. There are previous studies that have been inconsistent, so this review did aim to clarify the evidence using a quantitative synthesis of correlates. The research phase is correlational and explanatory. It looks at the determinants and correlates rather than interventions. The main purpose was to identify which psychosocial factors, like self efficacy, attitudes, motivation, or social support, are most consistently related to physical activity participation among adults living with or beyond their cancer. The authors wanted to integrate decades of evidence into one meta-analysis to better have a better framework of design to show these behavior change interventions. So that's what this study is. This study is focusing on what psychological and social factors are most closely linked with being physically active after a cancer diagnosis. The authors did follow PRISMA guidelines for the systematic reviews and meta analyses. They searched PubMed, PsycInfo, and Sport Discus. The inclusion criteria was adults who were 18 years or older, and they had to be diagnosed with any type of cancer. Um, they had to have assessed a psychosocial variable in relation to like their free living physical activity. And then um, what that included was like the not supervised programs of physical activity. Both observational and experimental designs were accepted. So, in total, about 1,713 records were screened and 64 studies were included. I did include the flowchart, which just shows that among the 64 included studies, um, some of them were cross sectional, a few were randomized trials, and a few were longitudinal cohorts. Um, the most common types of cancer that were seen in this study were breast, colorectal, and prostate, though some of these studies did involve mixed survivors, so people who had more than one type of cancer. And the psychological constructs came primarily from the social cognitive theory and the theory of planned behavior. I did include this table first. I want to talk about it a little bit. The authors computed this correlation coefficients for each variable. So the strongest positive correlates of physical activity were self efficacy, perceived behavioral control, intention, enjoyment, the perceived benefits, and attitudes. So those were the highest, and the strongest negative correlates were the perceived barriers for exercise. So, what this means is people who feel confident, capable, and motivated, and who actually find physical activity enjoyable and beneficial, are more likely to be active. There were smaller but still significant associations. that was subjective norms, physical functioning, quality of life, depression, and mental health. So, some of the results that we see um, leading to higher physical activity, like I said, higher self efficacy, intention, positive attitudes, enjoyment of the physical activity itself, and knowing the perceived benefits. And then barriers and depression were associated with lower physical activity. Overall, this review did show that psychological constructs strongly predict behavior, perhaps more than demographic or clinical factors do. The results did support existing theories like the theory of planned behavior and the social cognitive theory. Um, so, like, for example, self efficacy or believing that you can do it was consistently the best predictor of physical activity. The intervention should therefore include strategies such as mastery experiences, goal setting, and social modeling to build confidence in our patients and to build intention. We want them to intently want to participate in physical activity. The review also highlighted that barriers and depressive symptoms undermine physical activity, which suggests that we do need to address mental health alongside counseling exercise to our patients. Some of the key strengths include that this is the first meta analysis specifically on psychosocial correlates of free living physical activity in survivors. There, another strength is that is comprehensive search and the quality of appraisal. Um, it was a theory based categorization of variables, which was good. Some of the limitations include that it did have many cross sectional studies, so that is a big determiner of causality. There was um, possible publication and language bias with these articles, and then a few long term or intervention follow ups that were a little bit iffy with the results. So the authors did call for longitudinal studies using standardized psychosocial measures and more diversity, which did include non breast cancer populations in men. And they also recommended testing newer frameworks like the self determination theory, which looks at intrinsic versus extrinsic motivation. Personally, I do think that this paper is very relevant because it bridges psychology and oncology practice. It gives us as clinicians clear targets, like boosting confidence and enjoyment in physical activity for improving these survivors' quality of life through movement. Um, so, in total, changing beliefs and motivation can really be just as critical as prescribing the exercise itself. To wrap up, the systematic review and meta analysis shows that psychological confidence, motivation, and enjoyment are the strongest drivers of physical activity among cancer survivors. So, these insights can inform clinicians to more tailored rehabilitation and survivorship programs.